Hi, guys. Welcome back for our daily practice questions. It is day 35, and as always, I like to first get into my introduction and then my disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 70-year-old male with no history of cardiovascular disease presents for his annual exam. His lipid panel shows a total cholesterol of 210 milligrams per deciliter, an LDL of 130 milligrams per deciliter, an HDL of 40 milligrams per deciliter, and triglycerides of 170 milligrams per deciliter. He has well controlled hypertension, but no other risk factors. Based on current guidelines, which of the following is the most appropriate statin therapy for this patient? Is it a high intensity statin, B, moderate intensity statin, C, low intensity statin therapy, or D, no statin therapy? Take a moment and tell me what you got in the comments, y'all. All right, you guys. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states based on the current guidelines, which of the following is the most appropriate statin therapy for this patient? All right, so understanding statin therapy, and I will go through that in a second. I'm going to walk us through these questions, and then I'll break it down if you're not familiar or if you struggle in this area, okay? So the lipid panel shows a total cholesterol of 210 milligrams per deciliter. We know we want our total cholesterol to be less than 200, right? So that's abnormal. A LDL of 130 milligrams per deciliter. We know we want that LDL to be less than 100, right? So we're going to hold that as well. HDL 40 milligrams per deciliter. We know we want this to be 50 or greater because it states that this is a male. So men, again, is 50 milligrams per deciliter or greater, and women is 40 or greater, right? And then the triglycerides are 170, and we want that to be less than 150. But we're talking statin therapy here. And if you remember from yesterday when we were talking about our cholesterol management, I explained to you guys, remember that statin therapy is primarily utilized to focus on getting that bad cholesterol reduced and to provide more cardiac protection to reduce the risk factors of cardiovascular disease or the cardiovascular risk, I should say. So this LDL is 130. So the best answer is C, a low intensity statin. And why? Because yes, it's elevated, but it's slightly elevated, right? Remembering how your intensities work. And with a low intensity statin, it will lower that LDL less than 30%. So that'll get us about to where we need to go. And if you need to adjust or increase the intensity or dosage, you can do that, right? But we'll talk about it more. Question number two. A 58-year-old female with type 2 diabetes and hypertension is diagnosed with hyperlipidemia. Her lipid panel shows a total cholesterol of 250 milligrams per deciliter, an LDL of 160 milligrams per deciliter, a HDL of 45 milligrams per deciliter, and triglycerides of 190. What is the most appropriate statin therapy for this patient? Is it A, high intensity, B, moderate intensity, C, low intensity, or D, no statin therapy? Tell me what you got in the comments, y'all. All right, so this LDL is 160. So the best answer is B, is moderate intensity. Because we want to reduce that LDL more than 30%, but also this patient has even more cardiac risk factors, right? They're diabetic, they have hypertension. So you want to make sure that you are providing additional cardiac protection and remembering that moderate intensity statins can lower the LDL from anywhere from 30 to 49%. Okay. Question number 3. A 62-year-old male with a history of MI 3 years ago presents for a follow-up appointment. His lipid panel shows total cholesterol of 220 milligrams per deciliter, an LDL of 210 milligrams per deciliter, a HDL of 38 milligrams per deciliter, and triglycerides of 180 milligrams per deciliter. Which statin therapy intensity should be prescribed to this patient? Is it A, a high intensity statin, B, a moderate intensity statin, C, a low intensity statin, or D, no statin therapy? Tell me what you got, y'all. All right, so again, this stem of the question states, which statin therapy intensity should be prescribed to this patient? So let's walk through it again. And I know when I'm reading it, this may sound like just a bunch of numbers, but pause it, slow it down, walk yourself through, and tell me what you think, and then listen to my answer response. Okay. Total cholesterol is 220 milligrams per deciliter. Again, we want the total cholesterol less than 200. The LDL is 210 milligrams per deciliter. And because we are focused on statin therapy, this is that number we really are focusing in on because we are really targeting a reduction in that LDL, that bad cholesterol, right? And we know we want the LDL less than 100. So a high intensity statin, A, will be our best answer because high intensity statins lower the LDL 50% or greater. So we need at least a 50% reduction, right? And just walking through these labs a little bit more, the HDL is 38, and we know we need that. That needs to be bumped up, right? We need to increase that because we want it to be 50 or greater for males. And I'm just continuing, even though that has nothing to do with this answer, I just want to keep putting this in front of you so that when you see these questions or you run into this in practice, you know the ranges. And then your triglycerides, again, we want that less than 150. Now that we've done the questions, let me talk about the high intensity, low intensity, moderate intensity a little bit more. So again, on yesterday, I was explaining to y'all that statin therapy is primarily utilized to reduce that LDL, our bad cholesterol, and to provide that cardiac protection, right? We want to reduce our cardiovascular risk factors. We don't have time for that LDL to be through the roof when you have all these other risk factors that can lead to an increased percentage of CVD, right? And um, diabetes, hypertension, hyperlipidemia, all the things, obesity, previous MIs, all of these things are already risk factors. So we want to reduce it as such. So the main thing you need to know is that low intensity statins lower the LDL less than 30%, right? Moderate intensity lowers the LDL anywhere from 30 to 49. Then high intensity lowers the LDL greater than 50%. So it's just, the intensity provides a greater reduction in the LDL. So now you're probably thinking, all right, so how do I know which ones are low intensity, moderate intensity, and high intensity, right? So the two high intensity statins are your atorvastatin and your rosuvastatin, and it is based on the dosage of those. So atorvastatin, anywhere from 40 milligrams to 80 milligrams, and rosuvastatin, anywhere from 20 milligrams to 40 milligrams. And I just say that for those because those are the two high intensity statin in dosage range. Now, low and moderate have quite a few. You got to think about the statin therapy, but it's based on the dosage. So, more commonly, like your lovastatin, simvastatin, pravastatin, all of those things can be low intensity and they're dosed at like 10 milligrams, 20 milligrams, right? Whereas with moderate intensity, they're 40 and greater. So, with the majority of the low and moderate intensity statins, it's based off of the increase in dosage, the milligram dosage, that increases the intensity, okay? So if you struggle with this, and I do have videos on it, but I want you to do this if you want to see it more clearly. I'm a chart girl, but go and Google statin therapy intensity charts And it'll give you a chart with the breakdown and how the percentages are and medications that fall into it so you can see it. Now, will the test go so deep into asking you specifics to that range? No. But it will, you can get things like similar, like this question right here, asking you, would you give a low intensity, a moderate intensity, or a high intensity versus a torvastatin 40 or pravastatin 10? You know what I'm saying? So I just wanted to make sure you understood it, but I couldn't just leave you dangling and hanging right there and not understanding completely. So I hope that gives a little bit more clarity around statin intensity therapy and what we mean when we're saying that, and how you look at it and approach these lipid panel and cholesterol style questions. But I hope you found it helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864, or shoot us a text message. Or you can shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. A few things because I have received questions. My self-paced review course is all online, and that is the link to that takes you so that you're able to do my videos and the associated material with each system independently. And that is on a subscription basis, so you can start and end whenever you want. My 5-week reviews, you know that we do these periodically. So whatever I am teaching those classes, like we're currently in one right now, I will always put that out there so that you know, and provide those tools for you so that you're able to sign up. Um, my review book, you know, there's an ebook and paperback option. So both of those are linked there. The digital flashcards are linked there, and all of my QBank options are linked there as well. So, someone was reaching out asking about the variety of things. So I just wanted to go through those a little briefly so that y'all can have an understanding on each of those. But they're all, again, linked in the bio of the channel. And if you're looking to book any of my one-on-one sessions and custom packages and plans, as always, I say either call, text, or email, as I prefer to speak with you so that I can see what's really going on and what you need, so that I can gauge and make sure that you are booking the appropriate session type, okay? All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.